Father in heaven, thank you so much for the privilege of Christian fellowship, of encouraging one another in this great work that you've given us, of extending the healing ministry of Jesus. Bless each of my brothers and sisters, not just those who are in this particular workshop, but those who are in workshops throughout this facility, and also those who may be taking a break or maybe taking some time in other meetings. Be with each one so that we leave here closer to you and better able to fulfill your call. We thank you that you haven't called us to failure but to success. We thank you for it in Jesus' name. Amen. Amen. Well, we want to speak about diabetes lifestyle strategies, natural lifestyle strategies. And with that in mind, I want to begin with a key message about diabetes, a key message. And the key message is simply this: it's that diabetes will force you to change your life. Diabetes will force you to change your life. Now, some of you think, well, this sounds like a disappointing message. We thought you were going to give us encouragement. Well, let me tell you why this is such an important message, because there is a question about it. And the question is simply this: will you change on your own terms, or will you change on diabetes terms? Let me explain to you why I ask the question this way. I have seen patients, they've come to Weimar, and I think of, in other centers where I've worked over the years, I think of one woman who came to me and both her legs had been amputated before she came to Weimar. What do you think we can do with our natural lifestyle program that would help her legs grow back? There's nothing, right? Now think about it for a minute. Have you ever worked with a person with diabetes who told you they did not like to exercise? Who told you they didn't like to walk? Let me tell you, I have never met a person with their legs amputated who told me they didn't like to walk. They all want to walk. Do you understand my point? Because some people won't walk, they end up losing their legs. They wouldn't change on their own terms, they wouldn't exercise on their own terms, so they end up changing their life on diabetes terms, and now they can't walk. Isn't that tragic? What about diet? The most powerful diet that we've seen in our work, and we showed you some of the research from Dr. Barnard and others, the most powerful diet is a total vegetarian diet. And so you say, well, Dr. DeRose, I think you're wrong, and I'm going to work with something else. Well, I'm just telling you my experience, and my experience can be faulty. I'm not trying to defend that. But let's say whatever you think is the ideal diet. Maybe it's not total vegetarian, that's not a vegan diet. Whatever you do, it looks too strict for someone. And they say, I can't change my diet. I've been eating this way for 20 years, or 40 years, or 60 years. Well, the person feels it's too hard to change their diet, and then they end up on dialysis. And then what is their diet like? I'll tell you about a patient I had, a true story. He actually came to me after he was on dialysis. He was not a Seventh-day Adventist, and as I was getting his medical history, he told me with enthusiasm how when the doctors told him he would be going on dialysis, he did all this research. And he found out if he got on a low-protein vegetarian diet, he thought he could preserve his kidney function. He told me how excited he was, that for 2 years he was able to stay off dialysis by changing his diet. I mean, that's great. It was 2 years. But if he had learned about it sooner, it could have been 10 years, or it could have been that he never went on dialysis. Do you see my point? What he was illustrating, though, is he was willing to change on his own terms. In his case, he didn't. I don't know if he had diabetes, may have been hypertension and other things. But I'm simply saying, when it comes to diabetes, this is the decision we have to make. So anytime you talk with a person about lifestyle change, you're not giving them an option whether they're going to change their lifestyle or not. If you're honest with them, you say, you have a disease, whether it's high blood pressure, whether it's diabetes, whether it's atherosclerosis. We could say it about any of these, especially true with diabetes. The choice is not whether you're going to change your lifestyle or not. You are going to change your lifestyle. Are you going to wait until diabetes tells you the terms? Until diabetes says, well, you're going to lose your vision, or you're going to have kidney failure, or you're going to have an amputation. Are you want to wait for that? or do you want to be proactive and change on your own terms? So that's really the big question. So with that in mind, people ask the question, well, what can I change? What should I change? And that's really what we want to look at in this presentation. And it's really based on a good news message that I hope you've heard already when we spoke about insulin resistance. And the good news message is that diabetes can be reversed. Diabetes, largely type 2 diabetes, is a reversible process. Now, type 1 diabetes, the autoimmune, usually autoimmune destruction of the pancreas, is not a reversible process. But type 2 diabetes is. It's driven by insulin resistance, and we can reverse insulin resistance. Let me show you a fascinating study. By now, most of you know I do a lot of work with Native Americans. This was a study that was published in the journal Diabetes Care in 1994. A fascinating study of one of the Native American tribes most predisposed to diabetes. They're the Pima Indians in Arizona. What's so interesting about the Pimas is they have some cousins. They're genetically related tribe in Mexico. So there are Arizona Pimas, that's in the United States, and there's Mexican Pimas, that's in the country just south of the United States. We know they're cousins because they share the same oral history, they speak the same language family. Even genetic measurements show these two groups of Native Americans, these two tribes, if you will, are cousins. The evidence suggests the two groups separated some 700 or 1,000 years ago. So let's look at what's happened over those 700 or 1,000 years. What has happened is they've developed very different lifestyles. The Mexican Pimas live like their ancestors have lived for many generations. They live in a remote location. They don't live near a big city. They're very active. They eat a traditional diet that's low in fat. They eat lots of fiber, lots of plant foods, and they eat very little animal products. In this very reference in Diabetes Care, they described how they did a dietary analysis of these menus that were being eaten there by the Mexican Pimas, and they were only eating meat and poultry how often? Once every 1 to 2 months. I mean, they were nearly vegetarians, weren't they? Now, on the other hand, the Arizona Pimas, they were living in a densely populated area. If you've heard of the city Phoenix in the southwest, they're in that area. They're much less active, much higher fat diet, lower fiber, lots of animal products. Here's the question. We've been talking a lot about the difference between genetics and environment and lifestyle choices. Here's a natural experiment. What happens? Is there any difference in these two groups of people? Well, actually there are some impressive differences. This is an age-matched study. So they're the same age, the individuals that are being compared. The Mexican women, young women, average age of 36, much smaller group of Pimas, so fewer subjects. Arizona Pima women, same average age. Look at the difference in weight. The Arizona women, 50% heavier. Look at the height. You say, well, it's because they're taller. Well, I mean, it's only 5 centimeters taller. That doesn't let you gain 50% in weight. You could see their body mass index. This is considered on, they're a little bit heavier. It's kind of on the borderline of what we would consider optimal. But look at this, definitely in the obese range. Blood pressure in these young women, similar. Cholesterol significantly higher among the Arizona women. And then type 2 diabetes prevalence. How much type 2 diabetes? Nearly 4 times as much. Now, granted, these women are genetically predisposed. They have a lot of diabetes for a group of women in their mid-30s, but nearly 4 times as much. You look at the men, and it's even more dramatic. Average age of 48. You can see, again, men significantly heavier, a little bit taller, BMI much higher, and then cholesterol significantly higher. But then look at this. Look at the bottom line. Nearly 9 times the rate of diabetes in this population. So what is mainly causing these differences? Is it genetics or is it lifestyle? What do you think? Yeah, I mean, the evidence suggests this is lifestyle. Well, you say, Dr. DeRose, this is exciting news. Just think what we can do in Sweden over the next 700 years. Well, actually, you don't have to wait that long, because research has shown us that these kind of changes can happen in a much shorter time. This is research from Dr. O'Day, published now what, nearly 30 years ago, looking at another native population, this time native Australians. Somehow Dr. O'Day got these Australian Aborigines who had become urbanized to leave their urban areas on the coast and to move to the more interior of Australia to live in their ancestral home. And they did that for 7 weeks. On average, look, they lost 8 kilograms, and they greatly improved their carbohydrate metabolism. Their fasting insulin levels fell. Their fasting blood sugar levels fell. Their blood sugars after meals fell. What does all this indicate? What's happening? They're getting healthier, and their insulin resistance is dropping. They're reversing the underlying process that was causing the diabetes. So they are, if you will, reversing or regressing or turning back the clock, at least, on their diabetes. Well, this is not all, because some of you have already seen what can happen in a short 18-day program. I showed you data this morning briefly from Weimar's experience. This was from the Lifestyle Center of America that you heard mentioned earlier, that beautiful facility there in Oklahoma. It's actually where I first started working with Native Americans. And that's quite interesting. I didn't think about that angle on it. But because of our work there and our success with diabetes, I'm still doing lots of work with Native Americans, and we're doing this big nationwide campaign with the Centers for Disease Control. I wouldn't be doing that if I hadn't worked for the Lifestyle Center of America. So although some people in administration wanted to say it did no good and it was a failure, we're still impacting hundreds, thousands of people through this radio work, tens of thousands, I'm sure. So anyway, this is the data from our first 437 patients. We started the program in '96. We did this data analysis in 2000, presented this at one of the national public health meetings, as I recall. And what you see is you see kind of the same thing happening now in 2 weeks. It's an 18-day program, but the blood work is 2 weeks apart. And you see dramatic changes. These are all statistically significant, highly statistically significant. You can see dramatic drops in cholesterol. Look at percentages if you want to use SI units, because it's the same. 11% drop in total cholesterol, 13% drop in LDL. We do see often a little drop in HDL. Here's probably the best explanation for this. When you're rapidly dropping your bad cholesterol, you don't need as much good cholesterol to get rid of it. Do you understand? That's how HDL works. It's involved in what we call reverse cholesterol transport. HDL is like the garbage truck that takes cholesterol out of the blockages in your arteries, if you will, brings it to the liver. So if you're not making much garbage, you don't need many garbage trucks. To illustrate that, just as an aside, if you look at populations in the world that have the lowest rates of heart disease, like historically the rural Japanese, do you know what their average cholesterol runs? Historically, it runs about 100 plus their age, but doesn't usually get above 150. What are their HDLs like? I'm giving you the American units. I'm sorry to do that. Let me just tell you this. Their HDLs are low. So their total cholesterol is low, their LDL is low, but their HDL is also low. So if you have a very good cholesterol and someone's trying to get you worried that your HDL is not high enough, in most cases that worry is unwarranted. Okay, I'm saying in most cases because I'm not going to treat any of you individually from the front of a lecture podium, okay? But let's continue and look at some of the other changes. Triglycerides respond dramatically and rapidly to lifestyle. You can see here the highest triglyceride value pre-intervention was what? Over 3,000. The highest one post was 900. I don't remember if that was the same patient or someone different, but you can see on average a 20% drop in triglycerides in just 2 weeks. Very dramatic changes in a short time. Average person lost 4% of their weight in 18 days. And you can see here, average blood sugar improved 10%. And that's usually with people decreasing their medications. We're usually decreasing or stopping medications, and their blood sugars are still improving. If you're not familiar with fructosamine, it's like a short-term hemoglobin A1C. Hemoglobin A1C, or glycohemoglobin, will not change in 2 weeks. You need a longer time period. So the fructosamine allows us to see what happens in a shorter time. This is a paper you've seen a couple of times, Diabetes Educator in 2004. Again, similar changes in those parameters in 18 days. Now, one of our participants here is Dr. Wynne Horsley. Dr. Horsley, where are you, Wynne? Okay. Dr. Horsley is working with a newer lifestyle center in Hungary. He worked for many years at UC Pines. He handed me a paper on their research on reversing neuropathy. Now, he has an advantage that I don't have, and that is that he's a physical medicine specialist, and he knows how to do these EMGs. I'm assuming just from my quick look that you actually did EMGs on these patients. He's a very brave man with very brave patients. And so anyway, we just actually collected subjective data. So this is a self-reported pain and symptoms of neuropathy. This was a consecutive series. We looked at 30 patients who had significant neuropathy who went through our program. We presented this at a national meeting. Actually, researchers from Loma Linda helped us with the data analysis. This is what they filled out at the beginning of the program. It's what we call a visual analog scale. They would rate their numbness during the day. How is your numbness? If the worst numbness you could imagine is here, how numb are you typically? Maybe they put the X there. How are you at night? Is that numbness worse, the same, better? You mark it where it is in this continuum. So there are 11 different neuropathy symptoms that have been reported in the literature that they rated. And here's the characteristics. Just so happened that it was 15 men, 15 women. Most of them type 2 diabetes. They had had diabetes anywhere from 3 to nearly 40 years. And we did these various tests that I've been showing you. And what we found happened, the improvement that they recorded in just 2 weeks was anywhere from 20 to 45%. If you look at the different scales, that was the range that we saw. And here's the actual raw data, if you want to see what it looks like. So here's the numbness. The beginning of the program, 50% optimal numbness, and that was down to 33%. So that's a 33% improvement. You can't just subtract them. You have to do a little bit more math than that. And you can see here nearly a 40% improvement. And you can see here these are highly statistically significant for most all of them here on the different measurements of neuropathy symptoms. And so we had that data for all of those measurements, but I just showed you an example of 4 of them. Let me just tell you something kind of interesting, because Dr. Horsley, and if you want to talk with him about some of his data, I didn't have a chance to read it since he just handed me this, but I'm assuming you found actual measurement improvements in the EMGs that showed nerve function was improving? Yeah, very definitely. At Weimar some years ago, they published how painful neuropathy dramatically improved. After we did this work, I was saying, you know, we really need to get some ways to objectively measure this. And I was talking with a neuropathy researcher at one of the universities, and she said, why would you want to do that? You've measured the most important thing. You know, we treat people for symptoms. And so if their symptoms are getting better, so that made me feel less guilty that I couldn't do what Wynne did. But he actually has the data here with this comprehensive lifestyle approach. And a lot of it is not just the lifestyle. You were doing the contrast hydrotherapy, I'm sure, the alternating warm and cold baths, or not?
The most important thing actually is the lifestyle.
Okay.
Hydrotherapy that you add is just keep the people contented when there are others that are getting something every day.
Okay, so Dr. Horst, one of the treatments that we do, I actually think it's a little bit more powerful than that. Maybe it's because I've been biased by some of my patients. One of the things we do, because I'm not sure all that we'll be able to cover in this session, I'll tell you about the treatments that we do for neuropathy. It is, we think it's largely lifestyle related. There's a number of reasons for that. But we also do the contrast baths. So at Weimar, we have a bench where people are sitting in that bench, and there's 2 large whirlpools. So they're sitting with their legs. Well, I got to use the mic here because it's being recorded, even though you can hear me. So I'm sitting with my legs, imagine, both legs are here in the warm water for 3 minutes. And then I swivel over and I put them into the cold water for 30 seconds. And then I go back. We usually do at least 4 cycles of this. So it's the alternating warm and cold. Now, the question is that, placebo effect? Are we just making them feel good? But I actually remember one patient very vividly. He said, well, I don't need this, these baths. And he said, he still was following the same lifestyle, but after a couple days of not having the baths, he got worse. He said, that's really helping me. Now, maybe he got worse because his blood sugar was fluctuating more too, but I think it's biologically plausible because what's happening when you put them in the heat, it dilates the blood vessels, which would improve perfusion in the microcirculation. If you just leave them in the hot, though, the blood stagnates. So by putting it in the cold, that constricts the blood vessels. It's like providing an internal massage to the blood vessels. And a lot of the things, the biological mechanisms for improvement relate to blood flow. And so I think it's probably doing something, but Dr. Horsley has done more detailed measurements than I have, so you may want to don't dismiss his assessment. What happened with blood sugar control? You can see here, again, most of them had significant improvement, but actually some got worse as far as their blood sugar control. You're getting worried. Well, some people, let me just explain to you, they come on lots of medicines. Their blood sugar might be very well controlled, but they're getting worse. They're actually deteriorating. And we actually have to stop some of their medications just to be safe. Because when you get on a healthier lifestyle, your need for medication decreases. And so it's possible if they were under very good control, their numbers may be a little bit higher when they leave, but they're generally off medications. And here's some graphs as to what seemed to drive the improvement in neuropathy, some different factors. This is looking at blood sugar control. The more you improve the blood sugar, so that's looking at it this way, so negative numbers here mean improvement in blood sugar. The more the blood sugar improved, the more the improvement in neuropathy. So blood sugar control was correlated with neuropathy improvement. This looked at triglyceride levels. Very interesting, this relationship between triglycerides and neuropathy. Now, triglycerides, you may think of them as a heart disease risk factor, but the higher your blood fats are, the higher the triglycerides, the more your blood flow is impaired. So blood fluidity is impaired with high triglyceride levels. So this would affect oxygenation of the microcirculation. And so those tiny blood vessels that supply the little nerve endings that are being damaged probably are not getting as good a blood supply when the triglycerides are high. Triglycerides come down, and you see this relationship. The greater the improvement in triglycerides, the more they drop. This should be a negative here. That got cut off. The more the triglycerides drop, the greater the improvement in neuropathy. Well, did we find anything else helped with neuropathy? Well, this is a very important slide. And this is true for many things that we see in life. And that is the likelihood of reversal is partly age dependent. And the older you get, the less reversible disease processes tend to be. Now, is this good news or bad news? Now, some of you are thinking of your age, and some of you who are younger are thinking this is good news, and some of you who might be in my generation are thinking this is bad news, but that's the wrong way to present it in a public meeting. You tell people in public this is good news because you will never be as young as you are today, okay? So you want to get serious about this today, you see? That's what, if you think about it, there are great similarities between what we do in health ministry and what we do in evangelism. It's you think about these parallels. And trying to help people make decisions is very important for their success. And so you're always, when you're presenting material, you're trying to help people make good decisions. And instead of this being discouraging to a 70-year-old, you say, well, don't wait till you're 72. Do it now while you're 70. Better chance for improvement. We actually did something interesting in this research back in the 90s. Dr. Charles Marcel, some of you might know Zeno, who was involved for many years at Morelos, now is working with Wildwood. Dr. Charles Marcel and I were the original clinicians there at the Lifestyle Center of America. We went through the medical research literature and we said, is there any evidence that there might be some supplements that would also help with neuropathy? And we came up with a list of about 8 or 10 supplements. We printed out this list and we gave it to the patients. We gave them all the same list. We said, if you're interested, there's some data these might help. There's some suggestion maybe they don't. You're welcome to take some of these supplements or not. You can choose which ones you want to take. And when these 30 patients went through the program, we looked back at what supplements they'd chosen because we recorded it. And we actually found there were 4 supplements that were correlated with significantly better improvement. So what this graph is showing you is on average, if you didn't use any of those supplements, the average person improved 20% as far as their neuropathy with all the other lifestyle things. But if you used all the supplements, there was a significantly greater likelihood of improvement. Well, what were those supplements? They're listed right here. GLA is an abbreviation for gamma-linolenic acid. Gamma-linolenic acid is involved in some of the essential fat pathways in the body. By actual measurement, there is impairment in some of these fat metabolic paths when you have diabetes. So GLA is designed to deal with some of these blocks in the fatty acid metabolism in diabetes. Alpha-lipoic acid is a powerful antioxidant. So alpha-lipoic acid, there's been a lot of research, especially here in Europe, looking at alpha-lipoic acid. I think a lot of German research, as I recall. Is that something that's conventionally used in Germany, or is it more research? Any of you from Germany? Do you use alpha-lipoic acid in diabetes much? There may be another name for it, too. Anyway, there's a research based on that. We found that helped. Inositol is a compound in nerves. By actual measurement, diabetic nerves are deficient in inositol. I think the first person who alerted me to that was Dr. Calvin Thrash. Didn't he do a lot with inositol?
Yeah, I've been quoted a study on it.
Okay. Yeah, so Dr. Thrash there now has passed away, Dr. Calvin, but he did a lot of research into natural therapies. So we found inositol was helpful and vitamin E also. But the emphasis, and let me just, I put this up here because it's something important to mention. There are, in the research literature, there are some 400 to 800 botanical compounds that have anti-diabetic effects. It's a huge number of things in nature that have effects in decreasing blood sugar problems or addressing insulin resistance. But I'll tell you from my experience that there is nothing as powerful as comprehensive lifestyle change. There's data that suggests that the herb Gymnema sylvestre can help with blood sugar control. There's evidence that fenugreek can help. But listen, people don't have type 2 diabetes from a lack of fenugreek and Gymnema sylvestre. They have diabetes because of insulin resistance, and it's largely driven by lifestyle factors. Are you following along with me? So the average person comes with a mindset many times, if you're seeing them as a practitioner, well, I want to do something natural, but it's easy to take a pill. And if you can just tell me a natural pill to take, I'd rather take that than the metformin or the other drug that you're prescribing. That's not the message. The message is the lifestyle is the most powerful. And if we can do these lifestyle interventions, whether it's in our office practice, whether it's in a lifestyle center, whether it's in a church running a CHIP program, this is the most powerful. Okay, most of these people able to get off their insulin, and this we see in many of our studies. We saw it in this one. 10 of these people were off insulin at the end of the program out of the 14 type 2s that came. Some of them still on insulin, but dramatically decreased insulin needs. Most people able to get off most of their diabetic medications or decrease them significantly. So lifestyle powerful when it comes to reversing these disease processes. We want to take just a little bit more time and talk specifically about what the program looks like. Let me tell you how we still run the program at Weimar, at least how I run the program there at Weimar. And why I say that is Weimar is not a one-size-fits-all program. We actually have people that are They're actually working with the program. We have doctors that work there, as well as nurses and dietitians. And here's the interesting thing. The interesting thing is all of us have the freedom as practitioners to practice how we see fit. We're all pretty similar, but there's some of us that do more with the fasting than others. And again, this is something that Yuchi Pines did a lot of work with, and Dr. Was it Davidson at Emory University did a lot with supervised fasting and diabetes. If you put someone on a medically supervised fast, this rapidly lowers insulin resistance and rapidly lowers blood pressure. So this is something we typically do in our diabetes treatment there at Weimar. And of course, we do the other basic medical approaches. I'm not going to belabor all of this material. If some of you want it, I've been making the slides available. But remember this. We're not telling people not to keep their blood sugar under good control. The idea is not just do lifestyle things, even if your blood sugar is 400. It is important to control blood sugar in more optimal levels, but we've learned that many people doing that with medication are over-treating, and although you may have seen figures like this in studies, this is from the United Kingdom prospective diabetes study, you can't just keep extrapolating that out further and further. And the data suggests if you're using medication to do it, you probably don't want to get hemoglobin A1C much lower than 7.5. If you're doing it with lifestyle, the lower the better. So are you all familiar with the glycohemoglobin? So it's an average measure of blood sugar control. The same is true with blood pressure. The lower your blood pressure, generally the better if you're on a healthy lifestyle. I'm not talking about someone in heart failure or in shock, okay? But I don't find people get on too good a lifestyle so their blood pressure gets too low and it's a problem. Really. So we see healthy people all the time. Any of you that are practitioners, their blood pressure is 90/60, they're perfectly fine. They're healthy, they're young, they're trim. If you, though, are on medication, we're finding that you don't want to get that blood pressure probably much lower than 130 systolic unless there's some unusual things going on. Sometimes with renal conditions and other things might lower it a little bit more. But medication-wise, you don't want to lower it to, quote, ideal levels that you would see with lifestyle. Because the more you lower with medication, either blood sugar or blood pressure, it becomes diminishing returns. You're increasing the risk of side effects from the drugs without getting comparable benefits from that pharmacologic intervention. So just kind of keep that in mind. We're not minimizing the importance of good blood sugar control, but there's a bunch of slides here. Since we mentioned it, I'll show you this. This is from EPIC. We talked about the European Prospective Investigation into Cancer and Nutrition, published in the British Medical Journal a little over 10 years ago. And in this study, they looked across the population. They found the lower the hemoglobin A1C, the better. Again, these are not people who are being treated with medicine for diabetes. It's looking across the whole population. But you can't just say, well, because that's better, lower mortality, I've got a diabetic patient, I'm going to get them down to 5%. This is not desirable, and there are papers that have shown this. This is a more recent study in Lancet, again, another good European publication for us here at this conference, and they found, again, this maximal benefit when you're using medication around 7.5 for hemoglobin A1C. Drop it below that with medications, and you're going to increase the risk of all-cause mortality. So let's, in our last 10 minutes, is about all we've got. I'm going to tell you what, instead of me telling you what I think is important, I've been doing that all afternoon, some of you probably still have some unanswered questions, whether it's about diabetes or something else, and you have to be willing, though, to come up and ask the question. I know that might be somewhat intimidating, but it's being recorded. So if any of you are brave enough to come up and ask a question from up here, or it's a short question that I can repeat, we'll let you do that too. Anyone want to add to the dialogue today? Okay, we have a question.
Are there any vegetarians who have diabetes?
Okay, are there any vegetarians that have diabetes? Excellent question. The vegetarian diet is not a panacea for anything. It's not a cure-all. So we see people who are vegetarians who come with diabetes. We did show you a slide earlier today, if you were in my general session, from the Adventist health study, showing about at present an 80% decrease risk of diabetes in those who are vegans compared to those who are Adventists eating an omnivorous diet. And Dr. Fraser, being a good researcher, was very careful to say, well, we don't have all the answers in, and this may not hold up over time. Let me tell you, since this came up, I appreciate what the Adventist Health Study is doing, and something that no one's talked about here, other than maybe a passing comment, at least in meetings that I've been in. The Adventist Health Study realizes there's two groups of vegans in the church. Are you aware of this? At least two groups. There is actually one group who is, they're not only following the biblical and spirit of prophecy counsel that seems to point us in that direction, but also they're looking at the science. They're being careful to supplement with vitamin B12. They're following other scientific recommendations. They're not just saying, well, because I'm following a good lifestyle, I don't have to worry about getting colon cancer screening or other things that have been proven to be helpful as far as their health. So you have that group of vegans. Then there's another, then you have a group, well, I think I've described to you the two groups adequately. And so they're trying to separate those out, because you're going to find, and I think this is why sometimes the vegans look less healthy, because there's some people who are just very extreme people. One of you came up to me and you said, Dr. DeRose, I've known vegans who've been sickly. They're just eating the tomato diet, and this is not healthy. Well, it's true. Even in Ellen White's day, you realize some people were so strict with the health message that they made it health deform instead of health reform. And in fact, one of them was one of our leading physicians, Dr. Kress. He nearly died. He was the one that Ellen White prescribed that drink of grape juice with a raw egg put in it. Many of us think in retrospect he probably was B12 deficient. And that was given to Ellen White prophetically to help him. So yes, we can be too restrictive, so be careful of that. There's no merit, even as far as our health, by being on a narrower and narrower program. And since some of you asked me about this earlier, the raw food craze in some circles, I don't see any biblical or spirit of prophecy reason that we should stop cooking food. In fact, biblically, I see evidence to the opposite. My favorite text is Exodus chapter 16, when God gives the perfect food from heaven, manna, and he even allows them to cook it, to boil it. You remember, on Friday, they were supposed to prepare what they would prepare, and he gives them permission to cook this perfect food. So the spirit of prophecy also talks about the importance of thoroughly cooking things like grain and beans. You might say, well, we're sprouting our beans. Well, it's fine. If you want to go on an all raw food diet and it's helping you, I'm fine with that. But don't get up in church and say we all need to be on a raw food diet, or do what some Adventist author did, send me a book that they wanted me to endorse or something, saying, in the beginning, God said, eat raw food. And I looked in my Bible and I actually did not see that. So that was an apocryphal statement. Okay, well, we need to wind up. Thank you for your good questions, your participation. Let's thank the Lord for his blessing on our time together. Father in heaven, we do want to acknowledge you as the giver of all true wisdom. And you know, I'm a human being. We're all humans, and there's probably things I haven't said right and things that I haven't emphasized properly and things I don't understand right. But Father, we're thankful that we're not dependent on our limitations as presenters here at this conference. It's not an excuse for us not to continue to learn and grow, but you are the great physician. You're the one willing to guide each one of us and guide us in our ministries. Please continue to do that. Thank you for being with us today. In Jesus' name, amen.